COVID-19 case numbers are lower than we've seen at the beginning of the year here in Ontario. There are still some concerns over the impact being felt at ICUs across the province, with many patients needing to be transferred out of their own regions to receive hospital care.
How often are you having to transport patients?
So it's been increasing ever since the pandemic began.
Orange Air Ambulance has been providing transport service for COVID-19 patients since the start of the pandemic. But as more and more patients were becoming ill and requiring hospital care in ICUs that were already at capacity, the organization began transporting patients to hospitals in other regions that had space.
What we're trying to do as a system is trying to what we call load share or load balance the number of COVID-related critical illness patients in each intensive care unit, such that each hospital can manage an equal partnership level of COVID patients to be able to maintain capacity.
According to Orange, from December last year to January 24th, 2021, there were a total of 188 patients transported from Ontario ICUs to create capacity. Of that number, 50 of those patients were transported by local paramedics. 95 patients were transported from hospitals in Toronto, 39 from hospitals in York Region, and 38 from Peel, with a significant amount being transferred from ICU to ICU over the last 2 weeks.
We know that, unfortunately, as we maintain our focus on COVID-related illness, unfortunately, those people on wait lists with other non-COVID-related illnesses increase, and we have to keep an eye on the entire healthcare system, not just the COVID-related critical illnesses.
Almost 25% of all the ICU beds in the whole province were filled with people with COVID-19. What that is doing is crowding out many other important and sometimes even life-saving care.
About 2 weeks ago, Ontario recorded an all-time high of 420 patients with COVID-19 admitted to ICUs in one day. And while that number has decreased since then, freeing up beds, the Ontario Hospital Association says it's not just about freeing up space, but freeing up people that are able to provide quality care to patients.
And again, we don't have an infinite supply of those. So the modeling we've seen earlier this month suggests that if we get to a point where we have approximately 700 people with COVID in ICU, we cross the threshold after which there is no more capacity, none.
Now, officials with Orange say they have not transported patients with COVID-19 from other regions into Toronto area hospitals because of how severely the ICUs have been impacted here locally. They say their focus is on spreading it evenly across other hospitals so that not one particular hospital is burdened.